Friday, November 21st, 2014.
From NBC News, this is Today.
We are back with our month-long initiative for men's health. We call it No Shave Today. Last year, we all remember when Matt and Al paid a visit to the doctor to get their prostate screenings live on Today. Well, this year, Carson and Willie decided to top that. They are at the office once again of Dr. David Samadi. He's chairman of urology at Lenox Hill Hospital, and we've learned he's a very funny guy as well. And here with us in the studio, we've got gold medalist Scott Hamilton, who survived his own bout with testicular cancer. We're going to talk to Scott and catch up with him in a moment. But first, guys, no more stalling. Take it away.
All right, guys. Scott, great to see you, too, in this discussion as well. Dr. Samadi, good to be back with you this year, I think.
Thank you, sir.
Let's talk about testicular cancer. Who should be thinking about it, and how prevalent is it in our society?
So we want all the men between the age of 20 to 40 to do self-examination, because when you catch testicular cancer, like any other cancer, it's curable. 90 to 95% cure rate is very high, and there's no better time than November to talk about men's health, prostate cancer, testicular cancer. So I appreciate you doing this.
So when Willie and I go in for our examinations, as you're examining us, you can kind of talk the audience through, so they'll have kind of the rules of that self-examination that's so important.
Yeah, absolutely.
And this isn't just your average when you go for a physical and sort of turn your head and cough. You're going to do a little bit more than that.
Well, that's right. So the turn to the side and cough is mostly to check for hernias, and we're going to do that actually. So, but also look at the whole anatomy of.
While you're down,
while you're there,
get the whole thing.
Hey,
you know?
You pay the copay, might as well, like, take advantage.
All right, should we give it a dance here?
Absolutely.
Okay.
Who's going to play ball
I'll go first.
Okay.
There's a second one.
Nickelodeon. Okay.
That's your safe word?
Yes.
All right, Doc, go easy on him. It's my friend in there.
Wow.
Oh, easy.
All right. So here we
He's
are.
very anxious to get that started.
Okay.
See what we can hear.
So what we're doing here is we're going to first look at the testicles. So that there are obviously like two testicles. One is lower.
Obviously.
Well, if you
Chris
find
Huevos.
3 testicles, then that person has done a surgery, and sometimes you see that, but that's not the norm.
Okay.
Usually the left testicle is lower than the right testicle, and somebody in the studio over there is going to guess whether we have brief or boxers over here.
Dr. Samadi, have you no shame?
So, doctor, what are you looking for? What are you looking for, doctor?
So the size of the testicle is normal. You're looking at the texture of the testicle. It's smooth. There is no mass. There are no lumps or bumps. Behind the testicle, there's something called epididymis, which is where the sperm gets stored. So the sperm gets made in the testicle, gets stored in the epididymis, and then you look for the vas deferens. It's a tube that actually carries the sperm all the way out. Now I'm going to ask Willie to turn to the side and cough and make sure that there's no hernia. Go ahead. There you go. There's nothing on that side and this side. All right, perfect. So he's perfectly fine. I'm going to give him like a few seconds to prepare, and then we're going to come out in a minute. So I don't know. So he's perfect. Everything is great. He survived. I didn't have to use the nut. So it worked out okay. So
well, good.
Normal exam, normal size testicles, and you look at the whole anatomy behind it. He's perfectly fine. There are no hernias. Look, within few seconds, if there was any firmness, if there was any lump, we could actually. You made it, right?
I made it.
Wasn't so bad.
No, it's not bad at all. It took a few seconds. Very easy.
So that can actually save one person every 24 hours is diagnosed with testicular cancer, and that simple test can truly save lives. So congratulations.
And you don't have to be a doctor to go through that self-examination process to red flag to get in to see your doctor.
Absolutely. Carson, that's a great point. So self-examination, how often? Once a month after a warm shower, because the muscles are relaxed.
Right.
You can actually feel to see if you feel any firmness. That's what we're looking for. Lumps or bumps. And if there's any question, just getting an ultrasound. Simple ultrasound will tell us whether
I'll
there's
see you
anything.
next year. Good to see you.
Are we done now? Tag out. Tag out. Okay. Stuff in there. Big time.
All right,
Listen, Carson.
You're the next
You
contestant.
guys want to come in? No? Okay.
The ball is in his court.
Hey, guess what? Blake Shelton's in there.
And as
Okay, so
Carson
you're gonna
gets his
stand up
exam, we'll talk to Scott Hamilton. And Scott, I mean, we're having some fun with this, but the whole point of this is to remove the stigma from getting these exams because it's so important. Early detection. You had your own bout with testicular cancer.
And mine wasn't early. I mean, I was having severe abdominal pain, and it got to the point where 50 cities into a 60-city tour, I just couldn't take it anymore. And I went in and, I got the news, we seem to have found a mass, which I thought was funny considering my size. But it was the diagnosis testicular cancer, and I found out later on that the tumor in my abdomen was twice the size of a grapefruit, wow. and I had no idea.
Because sometimes it's symptom-free.
Yeah, no, I was on tour. I was in great shape. I was skating well. Everything was going really well. But then it was 4 months of chemotherapy, a pretty big surgery, and we're back to life.
And you made the decision to really go out there. In a sense, you became the face of this disease. Was that a hard decision for you?
Not really. I always joke in my speeches that okay, when I do the Today Show, I'm going to talk to Matt about this, but not Katie, because and now here we are, Savannah. So it is that there's something about it. It's kind of like it makes you a little uncomfortable, but at the same time, it's you just throw all that away because it's your life we're talking about, and you really need to be vigilant because early detection is still the best cure for cancer.
And you have such a great perspective on this because obviously you wouldn't wish for cancer, but you have done so much in your life after that happened.
Well, I think I talked to a lot of cancer survivors, and something within you is awakened with that diagnosis that you never possibly would have known existed without it, and you become stronger and more in touch and clearer, and you become this warrior that you never thought you could be, and it's an unbelievable journey.
Well, Scott, Carson's just had his own journey, so let's hear how it went. Doctor, everything okay?
Doc?
Yeah, so yes, he did also very well. There were no mass or lumps or bumps. Perfect anatomy. He's going to be okay.
Thank you very much.
Continue to do a good job. And as Scott mentioned, this could be a lot of times asymptomatic. You may not have any symptoms. You can wake up in the morning with a back pain, and God forbid the cancer is already spread. We don't want that to happen. And I also agree that I think women play a huge role when it comes to this, because look, guys, we don't want to go see doctors, right? And it's pain in the butt. You don't have the time. It's the women that bring us to the doctors. So there's a whole Samadi challenge out there for women who want to help us to really bring men to doctor. Prostate cancer, men's health, testicular cancer.
Right.
Women do a great job, but we need to get on board.
Get a little nudge to get in there.
Wasn't so bad, right?
No, not at all, and I appreciate it.
Well,
it's a nerve-wracking thing because at any moment you're afraid the doctor's going to say that they're discovering something.
Right.
As much as it's just a live demonstration, it's still it can be nerve-wracking.
We should convey though that was about 30 seconds.
That's
and it wasn't a prostate exam can be unpleasant, although everybody should get it. That wasn't even there was no pain, no discomfort, nothing like that.
Look,
so
I think just like absolutely.
Yeah.
I think it's a great message out there for
doctor.
people. You're welcome.
Appreciate it very much. Happy Thanksgiving to you.
We're free and clear.
Let's do it.
All right, man. Let's go out.
Congratulations.
Get a walk home here.
Very good.
Thank you
Very nice. Hey, Scott, real quick, your foundation. Tell us about that.
It's called CARES. It's the Cancer Alliance for Research, Education, and Survivorship. For 15 years, we've been at the Cleveland Clinic. Now we're going to grow, and in a spectacular fashion. Once you're diagnosed, once you've had a loss, I lost my mother to cancer. You become this warrior against cancer. So we're going to grow. We're going to expand, and I'm really excited about the future. We got a lot of stuff to talk about in the very near future.
We'll put the information on our website.
Speaking of growing and expanding, you've got 2 kids added to your family. We're going to talk to you about that next half hour. Scott, thanks for being with us this morning for this part. And we'll send it over to Natalie.